Hi guys. Today I'm talking about something that affects males. They often hear about it but don't fully understand it, which is the prostate. Prostate, not prostrate. Okay, the prostate is an exocrine gland of the male reproductive system. Exocrine simply means it secretes substances, and it is a muscle-driven organ that functions between aiding urination and ejaculation. Now, where is the prostate located? The prostate is located below the urinary bladder and at the beginning of the urethra. Now, what is the size of a prostate? The size of a prostate is about the size of a walnut. In Igbo, we call it uba, and it weighs about 20 grams. But when it is enlarged, it gets to about the size of an orange or a lemon. Basically, it gets enlarged with age due to hormonal changes. Yeah. Now, I'll still talk about that. But what are the functions of the prostate? Number one, it makes up 30% of the semen that is ejaculated. 30% of it is made up of prostatic fluid, and this prostatic fluid helps in neutralizing the pH, the acidity of the vagina, to aid the flow of the sperm cells and also initiate fertilization. That is number one. Number two is where the prostate is located during sexual intercourse and stimulation. It enables male orgasm. So, like the female G-spot, the prostate is the male G-spot. So, stimulating that area enables male orgasm. Number three, it aids in urination, like I said earlier. And the prostatic fluid contains enough zinc. Zinc is a mineral that helps reproductive health, and foods that are rich in zinc are very good for reproduction. Okay, I'll be talking about the conditions that affect the prostate. Number one is benign prostatic hyperplasia, the BPH, the common one. It's simply an enlargement of the prostate, and it occurs majorly, in older men, like I said, with age from about 45, 50, 55. Yes, so it's one of the conditions. The second one, and it will now cause, when the prostate is enlarged, it presses on the bladder and urethral area. That's why you now have difficulty in urination and ejaculation. Number two is prostatitis, an inflammation of the prostate. It could be caused by infection or other things such as penile injury, that's injury to that area. It could cause an inflammation. That place will be swollen and tender. And it's often seen in younger males too. This one has nothing to do with age. Then the third one is prostate cancer. Prostate cancer. It's as a result of a mutation or defect in the BRCA1 and 2 genes that is also implicated in breast cancer. But in this case, it causes prostate cancer. So these are the three conditions that affect the prostate, known ones. Basically, that the prostate is enlarged does not mean it is prostate cancer. Prostate can be enlarged, but it is not prostate cancer. I'll tell you how that can be differentiated. All right. Now, what are the signs and symptoms of a prostate enlargement or prostate cancer? Number one is blood in your semen and difficulty in urination. Yes, you find it difficult to urinate because the enlarged prostate is pressing on your urethra or bladder. Another thing is intermittent urine stream. Once you're urinating, as you urinate it will cease, as you urinate it will cease. Loss of bladder control, you can pee on yourself without even knowing. And then pain during sex, erectile dysfunction, back pain, sudden urge to urinate. These are some of the signs and symptoms of prostate enlargement or prostate cancer. Now, what are the causes of prostate enlargement or prostate cancer? Like I mentioned, age is one of the common things. It is said that number two is race. It said that one in 6 African men are likely to suffer from prostate enlargement or cancer. Then number three, hormonal imbalance. When there's an imbalance in your hormones, could be seen in younger males. Another thing is infection. Another thing is family history. These people are known as high-risk patients. If your uncle, brother, grandfather, someone related to you has ever suffered prostate cancer, your chances of also having the same thing is high, and you need to begin monitoring and screening on time. Another thing is health conditions. People that have certain health conditions like obesity, diabetes, hypertension, kidney issues, liver issues. Another thing is sedentary lifestyle, people that are also exposed to chemicals and radiation, men that are exposed to these things at work. Another thing is diet, red meat. Like I said, it is not good. What is the diagnosis? The diagnosis is the PSA test, prostate specific antigen test. So the prostate specific antigen is a protein that is secreted by both a normal prostate gland and the one that is enlarged or cancerous. But the difference now is when there is an inflammation, an enlargement, or cancer, the levels of this prostate specific antigen in the blood is being increased. You get? That's why this test is used to diagnose, prostate enlargement. Another thing is, like I mentioned earlier, if you're a high-risk patient, you need to get tested at least from 40 years of age, 45 upwards. You need to get tested, and the normal levels are about 0 to 4 nanogram per mil. Some people use 0 to 5 nanogram per mil because there is a significant increase with age. So depending on the age, there are ranges for it. You can check out that online too, basically. Now, there are also things that increase your PSA levels that may not be necessarily an enlargement or an inflammation or cancer. One of those things could be vigorous exercises like cycling. Yes, it can increase your PSA levels. Another thing is ejaculation or sexual intercourse. They can increase the levels. So it is usually advised that when you're about to take the test, don't do these things. Don't cycle, don't ejaculate, anal sex, and the rest of them. So that whatever your results is, you can be sure that it is not influenced by some of these activities. You can do the test without fasting also. Yes. Now, the thing is, you can take the test once, twice. If it significantly increased those 2 times, you can now, see your doctor and go further to do digital rectal examination. He will examine if there is an enlargement and then an MRI scan. For the prostate cancer, you can't necessarily use the PSA to say this person has cancer. What we'll go ahead to do is prostate, if it is being suspected, you go ahead and do prostate biopsy, where they pick out a few tissues from that enlarged prostate and examine it histologically to identify if it is malignant, that's cancerous or not. There are also, treatments or intervention for it. Lifestyle changes and exercises can help with it. Also, treatments that can either shrink that enlarged prostate or treatments that can as well enable you to be passing urine better. There's also surgery to reduce the size of the prostate. If it's cancer, there's radiation therapy, hormonal therapy. Now, this is all I've got to say when it comes to prostate. I hope you've learned something, and basically I'll just advise: eat healthy, eat more fruits, exercise regularly, maintain a healthy weight, go for regular medical checkups, especially if you're high risk patient, and if you're about 40, 45, try to take the test and just know what the levels of your PSA is. So, with that being said, I want you to share this information to any man in your life, your brother, your uncle, your father, your boyfriend, your husband. It's important. You could be saving someone, and just share it to anybody you know. Um, like, follow me on TikTok at MLS Debbie. Subscribe to my YouTube channel. I'll just leave the link to these platforms below, where you'll be getting regular, health informations, things that will benefit you. That's all I'm here to do for you. So thank you guys for watching. Thank you, and see you next time. You can turn on your notifications so that each time I post something, you just know that it's a valuable content and you rush and watch it. So thank you guys. See you next time.